I am pleased to greet all who have gathered in Chisinau, Moldova, for the Eastern Europe and Central Asia Regional Dialogue of the Global Commission on HIV and the Law. I know that your participation in this important event stems from your commitment to effective action on HIV, human rights, and development. We are also honored to have Commissioners Chauvel and Prasada Rao participating in the dialogue today. My special thanks goes to Michel Sidibé, UNAIDS Executive Director, for his guidance and the commitment of the joint UN program on HIV/AIDS to the Global Commission's work. In Eastern Europe and Central Asia, the number of people living with HIV has almost tripled since 2000, reaching an estimate of 1.4 million at the end of 2009. Women account for some 40% of new cases, compared to 24% under a decade ago. And 80% of people living with HIV in the region are less than 30 years old. Injecting drug use accounts for most HIV infections in the region, and the interplay between injecting drug use and sex work has accelerated the spread of HIV. Hepatitis C and TB co-infections are also on the rise, challenging weak and overstretched public health systems. This is why responding to HIV is at the core of our effort for inclusive development in this region. The coverage of life-saving antiretroviral treatment in the region is 19%, significantly below the global average of 36%. One key factor is the poor access to treatment for marginalized and vulnerable groups. 30 years since its discovery, HIV continues to thrive in contexts of inequality and violence, and among those who our societies choose to exclude, misunderstand, and stigmatize. The law can have a profound impact on the life of people, especially those who are marginalized and disempowered. The law, its application, and access to justice can also be powerful tools to challenge stigma, protect people from violence, promote public health, and protect human rights. This Commission's dialogue process is a unique opportunity to bring together communities and civil society on the front lines of the HIV responses, with law and policymakers. The aim is to create a space for constructive solutions that use the power of the law to devise effective and sustainable HIV responses. Today, as you discuss the complex interactions between legal environments and HIV in this region, I hope you speak and listen with candor and courage. Your dialogue today will certainly deepen the Commissioner's understanding, providing invaluable insights for their policy and advocacy work. I look forward to hearing of the outcomes of this exercise, which I am sure will have important and positive ramifications for HIV responses in Eastern Europe and Central Asia. I wish you all a constructive and fruitful dialogue. Thank you very much.